did Sophia know that they have allergies to nuts and lactose?
Oh, my stomach hurts. Sophia, what happened to your face?
What?
Huh?
Oh no. Was this peanut butter?
Assalamualaikum, my name is Sharifah Nadira, and I will explain about the digestive system. The digestive system is a group of organs that work together to break down food and liquids in smaller molecules. These nutrients are absorbed by the body for energy, growth, and repair. The system includes the gastrointestinal tract, which runs from the mouth to the anus, as well as accessory organs such as the salivary glands, liver, pancreas, and gallbladder. Through digestion, absorption, and movement, the digestive system helps the body release nutrients and remove waste. Next, the digestive system is important because it breaks down food into nutrients that our body needs to function properly. It allows the absorption of vitamins, minerals, and energy that support daily activities and growth. It also removes waste products from the body and plays an important role in supporting the immune system, as a large part of our immunity is linked to gut health.
Assalamualaikum, my name is Nurani Husna binti Muhammad Adini, and I will explain the differences between food allergy and food intolerance. Although they are often confused, they are actually very different in terms of how the body reacts. A food allergy involves the immune system. The immune system mistakenly identifies harmless substances, such as food proteins, as an allergen or a threat and triggers an immune system. In contrast, food intolerance does not involve the immune system. It occurs when the body is unable to properly digest certain food substances, often due to enzyme deficiencies or metabolic issues. So, the key differences is that allergies are immune-related, while intolerance are related to digestion. Food allergies often involve immunoglobulin E or IgE antibodies. When a person with food allergy consumes an allergen, these antibodies trigger the release of chemicals such as histamine. Because of this immune response, allergy symptoms usually occur rapidly, within minutes to a few hours. The severity of food allergies can range from mild to life-threatening. Common mild symptoms include a tingling sensation in the mouth, hives, a runny nose, stomach cramps, and itching. More severe symptoms include swelling of the throat or tongue, difficulty breathing, dizziness, and fainting, which may lead to a serious condition called anaphylaxis. On the right, we can see examples of common food allergens such as eggs, fish, milk, peanuts, sesame, shellfish, soy, tree nuts, and wheat.
Food allergies can occur due to several factors. Genetic predisposition means allergies can run in families. An altered gut microbiota or weak intestine barrier can allow allergens to enter the bloodstream more easily. Atopic conditions such as eczema or asthma increase the risk of food allergies, like vitamin B deficiency and cross-reactivity between similar food proteins, and also contribute to the development of food allergies. Food allergies can have several long-term effects if they are not well managed. Individuals may experience chronic digestive discomfort such as abdominal pain, diarrhea, or nausea. Food allergies can also lead to nutrient malabsorption, which may cause deficiencies over time. Changes in body weight can occur due to restricted diets. These conditions may reduce overall quality of life and lead to the development of food avoidance behaviors, where individuals become anxious or overly cautious about eating certain foods.
Food intolerance occurs when the body lacks specific enzyme needed to digest certain food components. As a result, digestion is incomplete, which leads to digestive discomfort. Unlike food allergies, symptoms of food intolerance are usually delayed, often appearing several hours after eating. Food intolerance is generally not life-threatening, but it can still be very uncomfortable. Common symptoms including bloating, flatulence, abdominal cramps, diarrhea, nausea, and sometimes vomiting. Examples of common intolerance include lactose intolerance, gluten intolerance, and fructose intolerance, as shown in the diagram.
Food intolerance can be caused by different factors, mainly related to digestion rather than the immune system. Enzyme deficiency, such as lactase deficiency, prevents proper digestion of certain foods. Poor gut microbiota balance and pancreatic insufficiency can also interfere with digestion. Other causes include sensitivity to food additives, side effects of medications, and stress, which can affect the digestive system functions.
Let's see the effects if these cases were left untreated. When a person with a peanut allergy eats a peanut, their body releases a chemical called histamine. Histamine causes the throat, tongue, and airway to swell, which blocks air from reaching the lungs. This makes it hard for them to breathe, causing shortness of breath, wheezing, and a feeling that the throat is closing. If the swelling continues, oxygen levels in the blood drops, and the brain and other organs may not have enough oxygen. Without treatment, this can lead to loss of consciousness, permanent organ damage, or even death. That's why immediate action is critical in severe allergic reactions. And we also have the effects of lactose intolerance if left untreated. When a person with lactose intolerance continues to drink milk or consume any dairy product, a frequent diarrhea can occur. This causes the body to lose important fluids and nutrients. Over time, this can lead to dehydrations and malnutrition. As a result, the person may feel weak, tired, and low on energy. If this condition is not managed properly, the body becomes more vulnerable to other health problems in the long term.
Hi, I'm Nurfatin Sulaika, Nisa. I'm going to talk about a diagnosis method. So, what is diagnosis method? A diagnosis method is a medical way used by doctors to identify the exact cause of a disease or condition by observing symptoms and using tests or procedure. Especially in food allergies and intolerance, a diagnosis method is the process doctors use to determine which food causing a person's system and whether the reaction is due to an allergy or intolerance. This is done by detecting immune system reaction or identifying digestive problems such as enzyme deficiency or poor absorption. Now let's talk about the diagnosis method for food allergies and intolerance. The first one is skin prick test and blood test. These tests are mainly used to diagnose food allergies. In a skin prick test, a small amount of blood extract is placed on the skin, usually on the forearm or back. The skin is then lightly pricked so the enzyme enters the surface. If a red, itchy bump appears, it indicates that the immune system is reacting to that food. This suggests the presence of food allergy. A blood test is another method used to detect food allergies. It measures the level of specific antibodies known as IgE antibodies in the blood. High IgE levels indicate that the immune system recognizes the food as a threat and reaction against it. These tests are quick and effective, must be interpreted by doctor as false positive can occur. Next, let's talk about the breath test. The breath tests are especially useful for diagnosing lactose intolerance and fructose malabsorption. During the test, the patient drinks a solution containing lactose or fructose. If the sugar is not properly digested, it reaches the large intestine where bacteria fermented. This fermentation produces hydrogen gas which is absorbed into the bloodstream and released through the breath. High level of hydrogen in the breath indicate poor digestion of the sugar, confirming an intolerance. For endoscopy and biopsy, an endoscopy with biopsy is used to diagnose celiac disease, which is a severe form of gluten intolerance. In this procedure, a thin flexible tube with a camera is passed through the mouth into a small intestine. The doctor examines the small lining and takes a small tissue sample called biopsy. If the biopsy shows damage into the intestinal villi, it confirms celiac disease. This method is important because untreated celiac disease can lead to serious complications such as malnutrition and long-term digestive damage. Last but not least, an elimination diet is commonly used to identify both food allergies and food intolerance. In this method, suspected foods such as dairy, gluten, or nuts are completely removed from the diet for a certain period, usually 2 to 4 weeks. During this time, symptoms are closely monitored. If symptoms improve, the food are then reintroduced one at a time. If symptoms return after eating specific food, that food is likely the trigger. This method helps the problem food in controlled way and is often used when laboratory tests are inconclusive.
Assalamualaikum, my name is Nur Shihira Amani and I will be presenting on food strategies management for individuals with peanut allergy and lactose intolerance. The first strategy is identification and awareness. Individuals with peanut allergy or lactose intolerance must be clearly identified and their dietary restriction should be well communicated. Food labels such as contains peanut or lactose-free play an important role on the food labels in helping individuals make safe food choices. Additionally, staff, food handlers or caregivers should be educated about these conditions to avoid accidental exposure. Moving on, another important strategy is menu planning. For individuals with peanut allergy, menus should include clearly labeled peanut-free options to ensure safety. For those with lactose intolerance, dairy-free versions of meals such as almond milk or lactose-free milk should be offered. Proper menu planning ensures that individuals can still enjoy balanced and nutritious meals without compromising their health. Next, effective communication is essential. Clear communication between food providers and individuals help prevent misunderstandings regarding dietary restrictions. Displaying allergen information on menus, food counters, or packaging encourages transparency and allows individuals to make informed decisions. Furthermore, food utensils and safety are also critical aspects. Separate preparation areas should be used for allergen-free meals, especially for peanut-free food. All kitchen surfaces, equipment, and hands must be thoroughly cleaned before food preparation. Proper storage, such as keeping peanut-containing products away from other ingredients, further reduces the risk of contamination. Next is ingredient control, which is crucial in food management. For peanut allergy, all peanut-based ingredients must be completely avoided. This includes not only peanut themselves, but also products that may contain hidden peanut traces, such as sauces, desserts, or processed food. Preventing cross-contamination by using separate utensils and preparation areas is also essential. For lactose intolerance, lactose-containing ingredients should be replaced with suitable alternatives. Lactose-free dairy products or plant-based options such as soy milk, oat milk, or coconut milk can be used. Reading food labels carefully helps in identifying hidden sources of lactose. Emergency readiness is especially important for peanut allergy and lactose intolerance, as reactions can be life-threatening. Staff or caregivers should be able to recognize symptoms such as swelling, hives, or breathing difficulties and know how to respond promptly, including the use of an epinephrine auto-injector if necessary. In the case of lactose intolerance, although it is not life-threatening, awareness of symptoms such as bloating, abdominal pain, and diarrhea allows individuals to manage their condition effectively, sometimes with the help of lactase enzyme supplements.
My name is Aisha Binti Asra, and that's why we need to listen to our body. Our body is always communicating with us, just not in words. Sometimes it speaks through stomach pain, skin rashes, or that uncomfortable bloating after a meal. These are signals from your digestive systems telling you that something isn't quite right. Learning to listen to your body is the first step toward healing. Food allergies and intolerance can be managed. It's all about awareness, balance, and understanding your limits. Start by paying attention to how your body reacts to different foods. Choose ingredients that nourish you, not harm you. Read food labels, plan your meals, and never feel ashamed of being cautious. Your health always comes first. And remember, living with allergies or intolerance doesn't mean giving up delicious food. It simply means discovering new ways to enjoy your food safely. So, eat smart, stay safe, and most importantly, listen to your gut.